Hey guys, and welcome back to Mondays with me, Dr. Crystal. So ever since I got into medicine, I hear all the time how young I look. Now believe me, it doesn't bother me. I will take that for as long as I can get it, but it does happen really frequently. Every time it happens, I think of an old show that I used to watch when I was really little called Doogie Howser. I don't know if you guys have seen it. It might have been before your time, but regardless, I'm gonna watch it today and you guys are gonna watch it with me. So I honestly really don't remember anything about this show besides there's a doctor that's really young. I think he graduates med school at like 14 years old and then he's basically just a child doctor. Let's do this. I'm actually really excited for this because I haven't seen this show in like 20 years. So this is gonna be the pilot episode.
Excellent negotiation.
Neil Patrick Harris, he's so cute.
Today's his 16th birthday.
This is unacceptable. Return to the vehicle.
Let me see.
What are you doing? You must have been drunk. Get out of there.
Hell out of there, kid.
Let go of me.
Walsh, come on.
Grab this idiot, will you?
Get your hands off me.
You want to go to jail?
No, you'll be going to jail for criminal negligence. This man has a dislocated fracture of the femur and he's going to lose his leg unless I fix it right away. Now hold his torso down while I rotate his leg.
What the hell are you
There's
talking
no
about?
pulse behind the knee. He'll lose his leg to gangrene.
Not moving this.
Just hold it down. And you, brace his neck. Please, hurry. Here we go. You ready? Okay, we're getting some circulation. Is he still breathing?
Yeah.
Good. Now go get me something I can use for a leg brace.
All right, so that was a very exciting intro into this show here. So Doogie's just driving along, taking his driver's test. He sees that there's an accident up ahead, and of course, he's gonna rush to the scene and save the day. So this is a trauma situation, so we're gonna go through the ABCs first, airway, breathing, circulation, and I'm pretty sure he checked if he was breathing because he asked about it later. I didn't really see him check a pulse, but if the guy's breathing, he probably has a pulse. And I think he noticed right away that this guy's leg looked really weird. So the femur is that big bone that's in your thigh. And we worry about fractures of big bones like this in trauma situations because when they break, they can bleed into the compartment and the bone's not sticking out. There's nowhere for the blood to go. So the blood is just building up in that thigh. And so Doogie evaluates the leg correctly. He sees that it is deformed and likely a femur fracture. He reduces the fracture and restores blood flow to the lower leg, and he probably saved this guy's leg. So go Doogie. I also like that he didn't forget to check if the guy was still breathing while he's working on his leg. The one critique that I do have is that I didn't see him ask if anybody had called for help. So usually the first thing you do is make sure that an ambulance is on the way because this guy is clearly gonna need a higher level of care. All right, let's continue. So, Doogie is wearing sneakers in the hospital in the intro. I know that if I did that in residency, somebody would have said something, but I guess he is a child prodigy, so he can get away with it.
We're going to see is William Johnson, black male, age 6, admitted 5:32 a.m. with cardiomyopathy and failure. We did a chest x-ray, EKG, and an echocardiogram. He has a murmur of mitral insufficiency. I gave him digoxin 0.125 milligrams, Lasix 20 milligrams BID, and aldactone 12.5 milligrams BID. Also, I'd like to send him to nuclear medicine for a cardiac scan at 9:30.
Thank you, Dr. Howser. All right, people, let's go take a look.
So that was a pretty good patient presentation by Doogie. He was going through what had happened with the patient, his assessment of what's going on, and the plan that he has for today. And so that's the general format that we'll go through when we're presenting a patient during rounds. Usually we wouldn't be talking about a patient while we're walking through the hallways because other people can hear. We like to keep patients' medical stuff private. In my residency, there were two different ways we would do it. Sometimes we would all sit together in a room and talk about all the patients before we went to see them. Other times we would all gather outside of the patient's room and kind of discuss their case before we went in. But either way, it wasn't just talking loudly while walking through the hallways because there's people all around and you don't want to say something that could potentially identify the patient and somebody else hear it, and that's just bad for HIPAA compliance.
Feel much better. We might even give you a new heart. What do you say to that?
Am I gonna die?
Hey, no way, forget that. We're gonna fix you up so we can get a really sick kid in here. Right, Dr. Josephson?
Right. Definitely.
Okay.
Okay.
This kid is debilitated. His renal function's decreased. His creatinine is elevated. He can't survive a transplant.
According to these test results, he most certainly can. The boy's mother's already given her consent.
On your recommendation. But statistically, he's got a better chance if we just repair the valve. Dr. Canfield, this kid's been in failure a long time. Let's get him out of failure, build him up, then do the transplant.
With all due respect to my learned colleague here, I have spent more years fixing hearts than he has been alive.
Henry?
And I do not need some 16-year-old snot-nosed genius telling me how to do my job.
So they haven't really said it yet, but I think that Doogie is supposed to be a resident here. I have never seen a resident argue like that with an attending doctor. When you're a resident, you're practicing under the attending above you's license, and so, you know, it's their butt on the line. You kind of have to do what they say. That doesn't mean that you shouldn't stand up for what you believe in if you really think something is right for the patient. Everyone should definitely voice their opinion and talk it out. That way that everyone together can decide what is best for the patient. Also, I know they're talking to a really little kid here. I didn't see if his parents were in the room, but I always learned you never promise a patient anything, never promise them a result, never promise them a good outcome from a procedure, because as soon as you do that, that's gonna be the person that the bad thing happens to. Let go.
Then I'm gonna lean in and sniff her shampoo. Girls love getting sniffed. Then I give her a lick on her lobulae auriculare.
You're gonna do it in public?
It's her earlobe, stupid.
This is amazing. They are really playing up the fact that he's a 16-year-old boy here. I love that he is trying to use medical words to talk about her ear. I like this a lot.
Oh, cool. It's exactly what I wanted. I love it.
Look at that calculator. So old. I get the excitement though, because in high school when I got my TI 83 plus, I was so excited.
I already did. Dave here said no.
I will not be called Dave.
David, he's just kidding.
It's disrespectful.
No, disrespectful is treating someone like a jerky kid just because he happens to chronologically be 16 years
You're not excused from this table, young man. Sit down.
I honestly can't imagine coming home from a long, exhausting day at the hospital and having to worry about talking back to my parents. Sometimes you just want to come home and be by yourself, or just, you know, be in a mood because the day was really rough. I feel bad for Doogie here.
An emergency, expecting a qualified physician, and I get a 16-year-old kid. That's negligence, pure and simple.
If you could just hold a little still, Mr. Finkelstein.
You'll be holding still for a big fat lawsuit in federal court.
So his suture technique looked pretty good. It looked like he was doing some simple interrupted sutures on a laceration. His ties looked on point. I've had a lot of patients tell me that I look really young, but I've never had anybody refuse to see me because I looked young. So I guess hopefully I look older than 16 years old, but poor Doogie, I mean, he's a competent doctor clearly, and this dude's giving him a hard time.
Oh, Nurse Spaulding.
There's just one thing I have to tell you before we do this.
What's that?
Happy birthday, Doogie.
Not gonna lie, I was a little nervous there for a second. That would be statutory rape. She is clearly much older than him, and he is a 16-year-old. So I'm very glad that didn't happen and it was just a joke. Yeah. I feel like in every medical show, people are like hooking up in closets and like random dark rooms, and As far as I know, that does not happen in hospitals. At least not in the hospitals I've been in.
Will you be there when I get it?
Are you kidding? No way I'd miss it.
Cool.
Cool.
All right, talk about good bedside manner. This dude has got it. He knows how to talk to this kid. He is very sweet. He's holding his hand. My heart is melting right now. Neil Patrick Harris, if you're watching, I love you. Okay, I have to know. Have any of you guys ever randomly gotten your ear licked by somebody and then decided like that makes you want to kiss them? That would, I don't know, that was weird. That was weird. But Doogie got his kiss, so good job, buddy. No!
My pants alarm. My beeper. I gotta call in Wanda.
This is very realistic. Pagers are the worst. Pagers ruin everything. Isn't it crazy that this show 20 years ago, Doogie's carrying his pager. Me, last year in fellowship, I was still carrying a pager. You think with all the medical advances, we would have gotten better at how we communicate in the hospital, but for some reason, we're still carrying pagers.
What happened?
He was asleep in his bed when he suddenly started to fibrillate. We worked on him for over an hour.
So this is a very real and very hard part of medicine. You're gonna lose patients, and luckily in the job that I'm in now, it's not gonna happen anywhere near close to what I've seen in the past. The very first time you have a patient die, it's definitely an experience that you don't forget. I don't think it ever really gets easier, but it is a part of medicine. It's something that we have to learn to deal with, and you have to learn to get past it or you're never going to be successful in your future practice. Sometimes it's a very different experience if someone is older or has a chronic disease and they're kind of prepared and know that death is coming, is a lot different than someone where it happens suddenly and their family is not really expecting it. I think it's especially hard with young kids because you see all the potential in the life that they could have had. But this is sad. I don't know if maybe this is the first patient Doogie's lost, but he seems like a great doctor, and I think he's gonna get past this and continue to be a great doctor.
The first time I lost a young patient, I cried like a baby. As you get older, you learn to handle it.
I don't want to handle it.
If you're going to be a doctor, you'll have to.
So as I was just saying, and as his dad is telling him, it's a part of medicine that you just can't escape. If you want to be a doctor, this is part of it. And it doesn't get any easier, but you learn how to handle it better. Aw, he's so sweet. So first kiss, and I was right, it was his first patient that he lost. That's a big birthday. That's a big birthday, Doogie. All right, that was the pilot episode of Doogie Howser MD. I hope you guys enjoyed the video today. If you want to see more videos like this, let me know in the comments below. Don't forget to like, subscribe if you haven't, and I'll see you next week.